Okay, we're now discussing in the lymphatic system the spleen. The spleen is your largest lymphoid organ. It's really in the left side, as you can see under the diaphragm right there. That's your spleen, right in there. So it's the largest. It has a fibroelastic capsule around it. It's real easy to damage in blunt trauma. Like if you were in a car accident and the steering wheel hits you in the abdominal area. It has a fibroelastic connective tissue capsule, and it has a splenic artery and a splenic vein. Okay, it doesn't have a cortex and medulla like the other organs. It has what we call red pulp and white pulp. And so here are the functions. It is a site of lymphocyte proliferation. Now, it's a secondary lymphoid organ, so the lymphocytes would have been educated in the bone marrow of the thymus gland. It does do immune surveillance, much like the lymph nodes. It cleans the blood. It is the major organ to get rid of old red blood cells. It's the major organ to get rid of. So those that have had a splenectomy will have a lot of damaged red blood cells. And there are other areas to get rid of them, but it's the primary. The spleen also, as it gets rid of the red blood cells, the macrophages store iron. You may recall that it is a site of red blood cell production early in life, but not a major site. The bone marrow is. And later when we talk about platelets, about 1/3 of your platelets are trapped there. So if you get hit in the spleen and it doesn't rupture, the platelet count in the blood would go up. So again, these are the functions. Read through them. These are the functions that you have for the spleen. Again, as I mentioned, the white pulp and the red pulp. Okay, two distinct areas. The white pulp area is more where the lymphocyte activity is, that particular. Red pulp is really the scavenger house, shall we say, for red blood cells. Remember, it's the primary site to get rid of red blood cells. So the white pulp and the red pulp, as you read on it. Here again is white pulp, and there's red pulp in here. Red pulp mainly for the red blood cells, getting rid of them. The white pulp mainly for lymphocyte activity there. A splenic artery and a splenic vein coming into this area called the hilum there. So again, you can read in the text. The spleen does have some degree of regeneration. It does have some degree of regeneration. Not as good as the liver, but it does have some degree of regeneration ability. I won't get into post-splenectomy patients and so forth. I go last to the tonsils. The tonsils are in the throat area, as you may recall. They have a partial connective tissue capsule around them that I want you to look at. You have the palatine tonsils, which are in the back, the lingual tonsils, which are under the tongue, the pharyngeal tonsils, which are in the nasopharynx area, and some have tonsils around the auditory tubes, which connect the ear with the throat area there. Here again would be your tonsils. These would be the palatine. Under here would have been the lingual tonsils there. Okay. Here again would be the tonsils. They form something called a ring of Valdayer. A ring of Valdayer, since they are an immune lymphatic organ type of thing, then you want to be protected in that area. So you can look at it as if they're forming a ring, shall we say, around with these here, then one called the pharyngeal tonsil, which you don't see on this drawing, the lingual tonsils, and so forth. Here again, these tonsils have enlarged somewhat, significantly enlarged. The only time that really you have to mandatorily take the tonsils out if it interferes with breathing, as you can see there. Here would be what we call the pharyngeal tonsil right there. Here's the nose. So you have that tonsil there. Then you'd have, this would be an example of a lingual, and this would be pharyngeal. So it's forming kind of a ring here. There would be one, this is what we call the auditory tube or eustachian tube, which equalizes pressure coming from the middle ear. So sometimes you have a tonsil right there also. This would be tonsil tissue. Remember, the connective tissue capsule connects it to the throat. But what you have facing the mouth would be these crypts and pits. And sometimes food can get caught up in these particular aspects there. Okay. So then we already talked about mucosal associated lymphoid tissue, GALT, which is in the gut, and BALT, bronchial associated, that you can read on. Peyer's patches, these would be in the GI tract as a diffuse area of lymphoid tissue. Here is another organ known as the vermiform appendix. The vermiform appendix, this right here begins your large intestine. This is called the cecum, and then you have an ascending colon, transverse colon, descending colon, sigmoid, and so forth. Well, where the small intestine starts with the large, hanging off the cecum is your appendix, your vermiform appendix that you see, and it is a lymphoid organ. Sometimes it can build up because of an infection and you have to take it out. But this is the appendix, so this is another area of lymphoid tissue. Here again is looking at the appendix. So please read in the chapter on all these various lymphatic tissues and organs. Thank you.